Hello and good morning, everybody, and good morning, my friends and my colleagues and my fans everywhere. Hello. Bismillah ar-Rahman ar-Rahim. I will talk today about an important clinical topic, which is seizure disorders. First, we have to know what is the definition of seizure. What is the meaning of seizure in as a medical term? Because, as you all know, everything has a definition. Everything has a meaning. A seizure is a sudden, uncontrolled electrical disturbance in the brain. It is sudden or episodic, uncontrolled electrical disturbance or abnormal electrical activity within the brain, causing changes in behavior or in movements or in feelings or in sensations or in consciousness level or content of consciousness, or any combination of these. In behavior, in movements, that's motor activity. In feelings and sensations, that is sensory activity or sensations. In the consciousness, that is the level of consciousness or the content of consciousness of the individual. Any sudden, episodic, uncontrolled electrical disturbance sweeping the brain, any area of the brain, and causing changes in these functions of the brain is defined as or is considered a seizure disorder. And as we all know, not every seizure is epilepsy. Sometimes we have what we call non-epileptic seizures. So seizures are divided into two categories: epileptic seizures and non-epileptic seizures. So every or any epilepsy is a seizure, but not any seizure is epilepsy. This is very important. Not any seizure is epilepsy. Maybe seizure, but not epilepsy, as I will mention now. But any case or any individual with epilepsy is considered a seizure disorder individual. So seizures are epileptic and non-epileptic. Same like the concept of hyperglycemia. Not every hyperglycemia is diabetes, but every diabetes is hyperglycemia, of course, because hyperglycemia is the most prominent biochemical denominator of diabetes, hyperglycemia. So we have what we call diabetic hyperglycemia and non-diabetic hyperglycemia. Same here, we have epileptic seizures and non-epileptic seizure disorders. So we go back again to talking about seizures. So we have seizures which are not epilepsy, like seizure disorders occurring due to low blood sugar, and this is hypoglycemia. Or rapid lowering of high blood sugar when you are treating hyperglycemia in a fast mode. That's why we should not lower the high blood sugar suddenly. It causes disturbance within the brain and may cause convulsive seizures. So high or low blood sugar can cause seizure disorders. Also, a concussion of the brain can cause a seizure disorder. Alcohol and other medications, especially during withdrawal, can cause a seizure disorder. So these are common causes. Or some electrolyte disturbances can also, electrolyte disturbances like hyponatremia and hypernatremia, they can cause seizure disorders in severe cases. Hypoxia can cause seizure disorders, as I mentioned. So these are all causes of non-epileptic seizures. But the most common is medications and intoxications and drug withdrawal and alcohol withdrawal. They can cause seizure disorders. So this is non-epileptic seizures. If the person or the individual experience two or more seizures and with at least 24 hours interval separating these seizures and without known or identifiable cause, we call this epilepsy. So in epilepsy, there should be minimum two seizures to diagnose, and with an interval of at least 24 hours between the two seizures, and in the context of an unclear underlying cause or reason, we call this epilepsy. And as I mentioned, the seizures can present in different ways depending on the functional disturbance which will happen in the brain as a result of this electrical disturbance or the abnormal electrical activity in the brain. Because anything which interrupts the normal connections, between the neurons and the nerve cells in the brain will cause the seizure disorder, whether this is a biochemical or a structural problem within the brain. That's why it might be related to a structural abnormality or a pathology inside the brain, or might be related to metabolic molecules or some abnormal molecules in the blood due to other organ system disturbance, and this will affect the brain indirectly. So it might be due to abnormal pathology within the brain, or might be extrinsic due to the effects of metabolites and including the different electrolytes, and this will cause a biochemical abnormality in the brain due to exogenous causes. Here is an extrinsic disease, not with an intrinsic within the brain. For example, in patients with a structural disease within the brain, most commonly inflammatory or autoimmune, like in patients with encephalitis, for example, they might get convulsions due to inflammation of the substance of the brain. If this is involving the area motor or sensory or autonomic area within the brain tissue. So here the pathology is intrinsic within the brain. So inflammatory pathology, including infectious causes like infectious encephalitis, viral encephalitis, for example, or in the meninges, bacterial meningitis, this might be associated or might present with convulsions or seizures. Here it is convulsive seizures. Convulsive because the electrical activity affects the motor area in the brain, so it will present with a convulsion, that is abnormal motor a movement with contractions of the muscles. Here is convulsive seizure due to intrinsic disease, that is intrinsic, that's pathology within the brain. Here, I give an example, is encephalitis, or maybe meningitis, or maybe autoimmune problem, like immune-mediated encephalitis or other pathology, which is immune-mediated also. In some cases also of multiple sclerosis, in rare cases they might get epilepsy, and this is demyelinating disease of the white matter, although it might involve the gray matter by indirect or by associated pathology. Also in neoplastic causes, a brain tumor might present with convulsion due to space here. The brain tumor is an intracranial space occupying lesion irritating the motor area or irritating the sensory area depending on the area of the tumor. It might also present with seizure, whether motor or sensory or autonomic seizure, depending on the site of the tumor within the brain. Is it in the motor area, frontal lobe or temporal lobe or occipital lobe, or where exactly, or in the diencephalon or infratentorial, or where? Any brain tumor might present at some stage with seizure, whether convulsive or non-convulsive seizure. So this is another example of pathology, neoplasm, tumor. So a tumor can be the cause of seizure. Inflammation can be the cause of seizure. Vascular cause also, sometimes cerebral hemorrhage. If near to motor or sensory area, it might present with seizure. A subarachnoid hemorrhage, an intracerebral hemorrhage. These are vascular examples of vascular causes of seizures. So this is vascular etiology. So we have inflammatory etiology, vascular etiology, neoplastic etiology, that is tumor. I mentioned examples. Inflammatory, autoimmune, traumatic in brain or head trauma with brain concussion. This might present with seizure also. So this is here example traumatic etiology. So trauma, inflammatory, infections, vascular, autoimmune, neoplastic, these are all immune mediated. These are all examples of intrinsic brain disease causing seizures, or sometimes we call it symptomatic epilepsy, that is epilepsy or secondary epilepsy. That is epilepsy which is symptomatic. It is a symptom of an underlying problem, pathology developing, and this is a common cause of epilepsy in adults, because most of the other causes of epilepsy in childhood is idiopathic or related to specific syndromes or hereditary syndromes, different from epilepsy in adults, which is usually, or in many cases, is a symptom of an underlying pathology. That's why we call it secondary epilepsy, or sometimes we call it symptomatic epilepsy. And we have to search for a problem within the brain or outside the brain. Outside the brain, this might also affect the brain through abnormal metabolites, and this is what we call, or maybe part of what we call, metabolic encephalopathy. So seizures might be one of the symptoms of metabolic encephalopathy, and here it is a group of symptoms and signs. One of them is seizures due to an abnormal metabolism in the body due to a metabolic disease, like what happens, for example, in the metabolic encephalopathy complicating chronic liver cell failure or uremia or respiratory failure or other organ damage. So, or maybe an endocrine also problem. So whatever the metabolic cause, most commonly an organ failure, it will produce metabolic disturbances which will ultimately affect the brain and cause a metabolic encephalopathy. And one of the features of encephalopathy is seizures. So seizures, confusion, headache, disturbance of consciousness, these are all features of metabolic encephalopathy complicating organ failure. And here the cause is outside the brain, but the brain is involved secondarily due to abnormal metabolism. And here the metabolic derangement within the body affected, of course, the brain and caused this metabolic encephalopathy. So the reason for seizures is maybe metabolic encephalopathy. So these are all examples of diseases which affect the brain and cause what we call symptomatic or secondary epilepsy or seizure disorders. So whatever you call it, seizures or epilepsy, it is symptomatic epilepsy. But epilepsy, by definition, it is anything which it's most commonly diagnosed in childhood and young adulthood and is related to an underlying disease of the brain, which is in many cases not identified. Same like essential hypertension and the secondary hypertension. In essential hypertension, the exact pathology is not clear, but there is pathobiology, but we don't understand it. That's why we call it essential or primary. And in the secondary hypertension, there is an identifiable reason. We have endocrine secondary hypertension, renal secondary hypertension, coarctation of the aorta, neurogenic blood diseases. These are all many categories of secondary hypertension in which if you identify or recognize the underlying cause, you can just remove. Cushing is a cause of secondary hypertension. Combs syndrome is a cause of secondary hypertension. Pheochromocytoma is a cause of secondary hypertension. Coarctation of the aorta is a cause of secondary. Polycythemia is a cause of secondary hypertension. Renovascular disease is a cause of secondary hypertension. Renal parenchymal disease, renal artery stenosis is a cause of secondary hypertension. Whenever you identify the cause and treat it, it will be okay. Same here in secondary epilepsy. There is an underlying cause, brain tumor, encephalitis, metabolic encephalopathy. Here, these are all causes, whether intrinsic within the brain or extrinsic due to some extrinsic pathology outside the brain, causing metabolic derangement in the whole body. And this metabolic derangement affected the brain tissue. Secondly, the substance of the brain and the irritation of the areas of the brain, whether motor or sensory, and caused different types of seizures, behavior, motor, sensory, autonomic, or combination of all of these together. But the classic epilepsy in childhood and in young adulthood is a different entity, and this is what we call it primary epilepsy or classic epilepsy or whatever the term is. It is the primary epilepsy of childhood, and here the epilepsy manifestations might start even from early childhood. That's in the first years, from the first years of life. or even immediately postpartum or postnatal, and that here is the epilepsy is different. Here is associated with different, many complicated syndromes in which epilepsy is part of the clinical picture of the hereditary syndrome. And we have many categories and many classifications of this, what we call primary epilepsy. Regarding the phenotype of the epilepsy or the seizures, we might get motor, we might get sensory, we might get autonomic, we might get psychic, and the psychic will be psychomotor and psychosensory. And the motor is different types. We have convulsive tonic, we have convulsive clonic, we have tonic clonic, that is a feature of post-tonic and clonic. And we have also sensory epilepsy, in which there is only abnormal sensations within the body. And we have autonomic also epilepsy, which present with autonomic features. And we have epilepsy which present with mixture of what I mentioned, motor, sensory, and or autonomic. So, and the motor sensory, we usually put it as somatic. That's why we call it somatomotor and somatosensory. And then, on the other hand, we have the autonomic epilepsy, which is particularly related to the problems within the diencephalon or in the temporal lobe, the areas responsible for autonomic functions within the brain. When they are swept by abnormal electrical activity, they will produce autonomic symptoms, because the normal physiology of these areas is responsibility for autonomic functions. It is mostly in the diencephalon, especially in the hypothalamus and thalamus, and in the temporal lobe and in the limbic system of the brain. So this is the definition and the what's meant by seizures, and the difference between seizures and epilepsy, and the causes of. In any patient presenting with seizure, we have to identify the underlying cause. This is the most important, because seizure is a symptom and not a disease. We have to recognize and address the underlying disease or pathology and treat it. If it is encephalitis, we have to treat encephalitis. If it is vascular problem, we have to treat the vascular problem. If it is neoplasm, we have to remove the tumor, we have to treat the tumor. So treatment of the underlying cause is very essential in the treatment of epilepsy. So epilepsy is a manifestation, it is a syndrome with different pathologies and different presentations. That's why we call it the epileptic syndrome. And the seizure is a disorder. It is a descriptive term of a disorder. And it is, we can consider it a symptom and sign at the same time. And we should search for the disease which causes this phenomenon or this disorder or this symptom and sign, which is the seizure. The most important is to identify the disease causing the underlying disease, the underlying pathology causing the seizure, and treat it. Treatment of the underlying cause is number one in the management of seizure disorders. If it is low blood sugar, improve the blood sugar. If it is high blood sugar, treat the hyperglycemia. If it is hypoxia, treat the cause of hypoxia. If it is metabolic encephalopathy, treat the responsible organ for that. Manage the renal failure, manage the liver cell failure, manage the metabolic cause. If it is electrolyte disturbance, manage the electrolyte disturbance. Proper treatment of hyponatremia, proper treatment of hypernatremia, etc. Proper treatment of hypoglycemia, proper treatment of hypoxia, because all these are the underlying causes of the seizure disorder. Seizure disorders should be differentiated clinically from other causes of sudden transient loss of brain function, for example, from hypoglycemia. It should be differentiated from syncope. Also, in many cases, syncope might be confused with seizure or epilepsy, or should be differentiated from acute confusional state, because acute confusional state may be a presentation of seizure if it affects the behavior. So the seizure might present with confusion, might present with staring spell, might present with abnormal movement, might present with confusion, as I mentioned, might present with loss of consciousness, might present with loss of motor power, a tonic seizure, or absence seizure. The features or the symptoms of seizure vary depending on the area of the brain affected by the electrical disturbance or affected by abnormal electrical activity. And what is the function? If the electrical activity sweeps a non-functional area, there will not be symptoms, motor or sensory or autonomic. It depends on the area affected by the electrical disturbance will be the symptoms, motor or sensory, that is somatic, or autonomic, or disturbance in behavior if it is affecting, or disturbance like déjà vu phenomenon, for example, like agitation, like panic, like these are all psychological manifestations of a seizure. It might also present with loss of consciousness, might present with acute confusion, might present with staring spell, might present with, these are all due to abnormal activity within the behavioral area responsible for behavior, like in the diencephalon especially. If the abnormal activity is within the diencephalon, because many of the behavioral functions or the components of the behavior are in the cerebral cortex and in the diencephalon and in the limbic system of the brain, or the connections between these areas. So if the electrical activity affected these areas, they will present with disturbance in consciousness and disturbance in behavior and disturbance in memory and disturbance in other functions. If affects the motor, there will be convulsions. If affects sensory, there will be abnormal sensations. If it affects autonomic, there will be autonomic features like hiccup, like vomiting, like these are. So sometimes vomiting is a manifestation of autonomic epilepsy, persistent vomiting, or persistent abdominal even pain. One of the differential of upper abdominal pain, for example, is autonomic epilepsy. It will present with atypical abdominal pain. One of the causes of atypical chest pain is also autonomic epilepsy. One of the causes of vomiting, one of the causes of hiccup is autonomic epilepsy. These are autonomic symptoms. So not all epilepsy is convulsions, that is motor. No, there may be sensory, there may be autonomic, there may be psychological, there may be other mixture of all of these together. Thank you so much. And this is about seizure disorders in clinical practice.